Hi, everyone. My name is Jessica Fetterman, and I am the Director of Public Relations and Marketing at Robert Wood Johnson University Hospital in Hamilton, New Jersey, and I will be facilitating our discussion today. With me today are Dr. Kevin Law, who is a specialist in critical care and pulmonology here at Robert Wood Johnson in Hamilton, as well as Vivian Wasu-Mensah, who is a doctor of practical nursing, as well as our lung navigator here at the Cancer Center at Robert Wood Johnson University Hospital, Hamilton. Today we're going to discuss vaping. We're going to discuss what it is, who's affected by it, and the current health crisis relating to it. If you'd like more information, we will provide additional printable materials for you, as well as contact information for our two expert panelists. So now we're going to get started, and we're going to start with Vivian, who's going to start by telling us what is vaping.
So vaping is a term introduced by the electronic smoking device industry to refer to any electronic vaporizer such as e-cigarettes, vape pens, and e-hookahs. Vaping or e-cigarette became popular in 2007, and it was an alternative way to help people stop using cigarettes, but still get the nicotine and be able to vaporize it and inhale it without all the chemicals associated with cigarettes. Now, e-cigarette or vaping is highest for among boys, whites, middle school, and high school students. There are different types of e-cigarettes, but the one popular brand is the Juul, which is very prevalent with teens due to its size, fruity and sweet flavors, and actually looks like a USB device.
Wow, that's a lot of information, and it's important for everybody to know how, who is affected by this issue, and that it's even young children that are now partaking who need to know this information. So Vivian, can you tell us a little bit about the current health issue that's facing us with regards to vaping?
Yes. So many people incorrectly believe that these devices produce a water vapor when in fact they create aerosols that contain harmful chemicals and ultrafine particles that are harmful when inhaled in the lungs. The current health issues regarding vaping is really puzzling because it's really hard to identify what substance exactly is the cause. There are actually three main categories that are used in vaping, which is the nicotine, THC, and the CBD or weed oils. And according to the CDC, all patients with reported cases of lung injury associated with vaping had history of e-cigarette use or vaping concentrated marijuana within 90 days before the symptoms occurred. And among the reported cases, majority, over 80%, were male, and the average age was 19, with the age ranging from 16 to 33.
Those are young folks for sure. So what are some of the things that people should look for if they feel like they may be reacting to the vaping?
Yeah, so some of the symptoms that has been reported are respiratory symptoms. 98% of those people complained of chest pain, dyspnea on exertion, and cough. Also presented with GI symptoms such as nausea, vomiting, diarrhea, or even abdominal pain. And some of the patients also presented with constitutional symptoms such as fever, night sweats, and chills, which are might make one think that they have an infection, but in fact do have vaping-related issues.
So if they're not feeling good, they should go see their doctor?
Yes, definitely.
Okay, great. So is there anything else that you would like to share, or should we check in with Dr. Law?
We can check in with Dr. Law.
That sounds great. Thank you. Hi, Dr. Law.
Hi, how are you?
Hi, good, thanks. Thanks for being here today. So
Sure.
we heard about some of the basics from Vivian about who's affected and what it is altogether, but I know you have so much research and understanding about this topic, so I'm grateful that you're here today to talk with us.
Yeah, right.
So I guess, go ahead.
Yeah, no, I was just going to thank Vivian. That was very informative. I learned a couple of things.
It was great. Wonderful. So Dr. Law, please get us started. Can you tell us a little bit about some of the information that's been published out there about vaping?
All right, so I'm going to first start with the demographics. So when we first presented this over a month ago, we had 770 patients in the United States that had been ill as a result of vaping. As of yesterday, that's up to 2,051 patients. About 91% of these patients have been hospitalized. They're predominantly male. It's about 70%, but we've definitely had female patients. We've had one at this hospital. The hospitalizations may have peaked in mid-September. It's difficult to tell because there's a delay in the reporting, so the peak may actually come later. Most of the affected patients were between 18 to 34. As Vivian was saying, it's about 80% of the patients. The deaths, curiously, tend to be more in males and in an older population. So the median age of the deaths were in males the average age was about 50, okay? The youngest patient to die actually was an unfortunate 17-year-old in the Bronx in New York City. There's, as of this date, been 40 deaths nationwide. There's been 3 in California, Georgia, Illinois, Indiana, Massachusetts, and Minnesota. That's not a statistic that anybody would want to have, but that's the unfortunate truth.
That it sure is. That's amazing numbers there. And it is updated since we started pulling together this presentation. Can you tell us a little bit more about what we're seeing?
Hold on. So I'm going to review the Illinois and Wisconsin data. They, about a month ago, got together and pooled all their data with a vaping associated illness. They had 86 people. The age range was between 15 and 53. 60% of those patients wound up in the ICU. The predominant implicated vaping product was a pre-filled THC cartridge, 87%. Most of these, unfortunately, are produced on the black market under a variety of different names. Some of the products that have been implicated, number one far and away, is the so-called dank vape. This is believed to be manufactured somewhere in California. It's a pre-filled cartridge. It can be purchased off the internet. Sometimes it's traded from person to person. Some other brands that have been implicated are Moon Rocks, Off-White, and TKO. Typically, people use these cartridges because there's no odor and allows them to evade smelling like marijuana. There have certainly been some nicotine products that have been implicated. The one most commonly mentioned is Juul. Juul's a dominant brand. It's flavored cigarette. Any of the flavored brands have potentially been implicated, though.
Wow, that's really good information for people to know these exact brands so that if they see them, they know specifically to stay away from them, though it sounds to me at this point that staying away from vaping in general is probably the best idea.
Well,
Dr. Law,
we'll get there with more specifics, okay.
Most definitely. So now we come to some of the signs and symptoms of vaping, which Vivian talked a little bit about. Do you have any more information that you can share with us?
Sure. I mean, she was exactly right. I mean, the predominant symptom is going to be respiratory. It's usually shortness of breath or dyspnea, cough. Sometimes we see atypical chest pain. This is usually associated with a severe diffuse pneumonia, when we've seen it or where it's reported elsewhere, patients generally require supplemental oxygen. They are unresponsive to antibiotics. It can progress to respiratory failure. There have certainly been people on ventilators. There are people who have died from respiratory failures, predominant mode of death. It generally requires hospitalization and possibly the ICU. Fortunately, once you've identified the cause, it improves rapidly with steroids. It's just that you have to rule out a lot of other potential possibilities as the cause of the illness. There's an associated strong and intense immune response that we're taking a look at. Now, the interesting thing is there are some non-respiratory symptoms, as Vivian noted. Predominant one is GI. These include abdominal pain, including right upper quadrant pain, mimicking gallbladder disease, anorexia, meaning loss of appetite, nausea, weight loss, and diarrhea. We've even had some of these patients admitted to the hospital as either a gastroenteritis or some other abdominal diagnosis like gallbladder disease or acute cholecystitis, only to be proven to have vape-associated pneumonia. The other group of symptoms you see are what are called constitutional symptoms. Patients will report that they're weak. In addition to the weight loss, they'll have fevers up to 103 to 104. These can be quite high and associated with chills. So I'm going to go on. I'm going to show you some of the typical X-rays and CAT scans that we've seen. This is one patient. What you're seeing here is what are called ground glass changes. They can be really subtle. This is predominantly in the upper lobes in this particular patient, and it's bilateral, meaning it's in both lungs. This is the lower lung fields on that same patient. You can see those ground glass changes. They're predominantly at the bottom of the page in both the right lung and the left lung, okay? This is another patient. These are diffuse infiltrate. Anything that you see as white and cloudy in the black space that constitute the lungs, those are infiltrates. These are predominantly ground glass infiltrates in this case. You can see that they're scattered throughout both lungs, both anteriorly and posteriorly in the front and back. This is that same patient, patient 2. These are the lower lobes with almost like a cloud-like effect. This finding is very consistent with a toxic or chemical pneumonitis. You could see this kind of infiltrate. Anybody had inhaled a toxic substance. And this is what the axial view, a front-on view of the CAT scan looks like. You can see that there's scattered infiltrate throughout both lungs involving both the upper and lower lung fields. In the center, you see the heart, which is not involved in the disease in this case. This is a third patient. This is what the X-ray looks like. These were severe, predominantly lower lobe infiltrates affecting both lungs. This is a patient that was quite sick. They wound up on high flow oxygen. And this is what the lower lobes look like on CAT scan. This is what's called a radial view. You can see really dense, intense infiltrates in both lower lobes. And this is the axial view of that patient with diffuse infiltrates, predominantly in the lower lobes, although there's clearly some infiltrate in both upper lobes as well. But these are very dense infiltrates. This patient almost went on to respiratory failure. Fortunately, they responded over a period of 4 to 5 days to systemic steroid management. So I'm going to talk about the Food and Drug Administration and what they're doing in terms of testing. Vaping has been in the United States since 2007. The FDA has only been considering regulation since 2016. As of late September, they had 300 samples, 150 were tested. 70% of those products were THC products, the rest were nicotine products. 50% of the THC products were contaminated with vitamin acetate, which is used for diluting the THC in the cartridges. There are actually over 7,000 chemicals, including formaldehyde, which is a known carcinogen, that are increased in this liquid. Current recommendations are to avoid, their recommendations, this is the Food and Drug Administration, is to avoid vaping if possible. They recommend not purchasing anything off the street that might be a black market product. And do not add anything to it do not add anything to a commercial product that's out there. If you do not smoke, they would recommend that you avoid vaping altogether. And young people and pregnant people should especially avoid this. One other addendum I'll add to this slide: the Washington Post is reporting today that the FDA the CDC actually has tested 99 lung samples from patients that died. Out of those 40 patients that have died across the United States, they have 29 samples. Every single one of those samples actually contained vitamin E acetate. So some people believe that is going to be the implicated ingredient that is causing this disease, but that's very much a product of speculation at this time. So just some important things about vaping. I think obviously when you have a problem like this, there's a reaction to the events. Sometimes it can be an overreaction. It's important to remember that research generally concludes that vaping is actually safer than cigarettes. In the U.S., those seeking to smoke are generally using cigarettes and e-cigarettes simultaneously. E-cigarettes do decrease secondhand smoke, which is an advantage, but it's important to understand that it still exposes other people to nicotine, and we know that because you can test urine and you detect cotinine in patients exposed to e-cigarette users. E-cigarettes appear to be easier on the environment, and there's a reduced fire risk. The British experience is quite different from our own because e-cigarettes are highly regulated there, and it's considered an important aid in smoking cessation. I'm going to go on and talk about that a little bit more. Jessica, you can hear me?
I sure can, Dr. Law. Thank you.
Okay, great. All right, so I'm going to talk about the British experience. So the Royal College of Physicians promote this as a smoking age, and only a small fraction of the risk of smoking. There's very tight regulations there. They don't have flavored cigarettes. THC is difficult to obtain. There's a call to license this as a medicine. They do not allow TV, online, or radio marketing. The director of the UK Center for Tobacco and Alcohol Studies actually considers the situation in the United States where there's no regulation absolute madness. The vaping industry is heavily regulated throughout Europe. That includes Austria, Belgium, Germany, and Italy, where they all regulate their vape products. And they cite over the last 5 years that they've only had 200 potential health events, or what are called adverse events, potentially linked to vaping, despite the fact that they have over 3.6 million users. So this is very distinctly different from the U.S. experience. So I guess the question is it time to regulate vaping in the United States? And it seems obvious that that probably is coming. The federal government is considering a ban on all flavored e-cigarettes. As of yesterday, 6 states have enacted a ban on flavored e-cigarettes. There actually have been complete bans on all cigarettes in both San Francisco and, curiously, at a Pine Ridge Sioux reservation in South Dakota. And there's a 4-month ban on all vaping products in Massachusetts. Again, that's a state that's had 3 deaths and a lot of incidents of vape pneumonia amongst young individuals. And Los Angeles, Chicago, and Illinois are also seriously considering a ban on all vaping products. So that's all I had on my slides now. If you have any other questions for either of us, we'd be glad to answer them.
No, thank you so much. This is all such important information for people to know. So with all of this information, if somebody's decided that they would like to learn how to maybe stop vaping, if they feel like it's something that they would like to sort of remove from their life, Vivian, is there anything going on at the hospital that can ensure that can help people to stop vaping, and then also any concerns that they may have in terms of like lung screenings and things like that?
Yes. So we do have a very comprehensive lung and thoracic program here, which consists of a thoracic telemedicine, thoracic tumor board conferencing, pulmonary nodule clinic, and tobacco cessation services. And as far as the lung cancer screening, there are some guidelines, and you have to be at least age 55 and above with 30-pack year smoking history. And if you've quit smoking, it must be within the last 15 years. And of course, no signs and symptoms of lung cancer, such as coughing up blood, losing significant weight loss without even trying to lose weight. And the screening is covered 100% by insurance if you do meet this criteria. As far as our tobacco cessation program, we do have a customized quit smoking plan for individuals, group, and family as well. And we do behavior modification, and if the person is interested in prescription smoking medications, we can also offer that, and all these are free.
And Jessica, I just might add, I still think that vaping tobacco products, and I'm talking about unflavored, regulated tobacco products without ingredients like vitamin E acetate and so some of the other implicated ingredients. I still think vaping is a potential important means towards smoking cessation. It's safer in general than smoking. I still think that there's a role for it. Hopefully we don't go in the complete opposite direction and eliminate it altogether in this country. I just think it needs to be regulated. Certainly when people vape, they have to know what they're vaping and that it's safe, and it hasn't been adulterated in any way. And I certainly wouldn't use any black market product because I think you're taking a serious risk with that behavior.
Most definitely. So thank you both. So if somebody is concerned, they should see their doctor, or they can call you, Dr. Law, or they can call you, Vivian. We'll put your contact information up there so that if people have questions, they can connect with you. But thank you so very much for your time and your expertise and for sharing this information with our community today. And thank you again, and have a great day, everybody.
All right. Thank you.
Thank
Jessica.
you.